Many patients will ask, whether egg collection is a surgery or, like what type of procedure. See, egg collection is a very small procedure. It takes just, like a few minutes, depend upon the follicles. So here, if you see that, there is only two follicles are there. So this patient is poor responder actually. So egg collection mainly done by through ultrasound guided procedure. Actually, probe guide will be there. Through the probe guide, they will insert the needle and go to the follicles and slowly penetrate the follicle, and then you give a suction. Slowly that follicle will collapse. So when it's collapsed, along with the follicle, follicular fluid and like a oocyte or egg will come directly to the tubing. In this tubing, they collect along with the follicular fluid. So you can see here transvaginal probe is there. So they inserted inside, and then they also check through the ultrasound, and you have a ultrasound marker also there. So without like a disturbing like a follicle, exactly in the center position we can penetrate and slowly give a suction. There is a suction pump will be there. So through the suction pump, slowly the follicle along with the follicular fluid, and in the follicular fluid egg will be there. So most of the patient what they ask is whether, sir, this is a like a surgical procedure, or did I will get any pain, or after collection. All those things there is a lot of doubt patient will ask. See, the egg collection is very simple procedure, painless, and also only few minutes only. Like if there are less number of follicles, only few minutes. If there is a more follicle, approximately 10 to like a 12 minutes it will take. So once the follicle is like giving an suction, you can see in the controlled manner, like a 37 degrees maintained, there is a test tube warmer will be there. In this test tube warmer, the fluid will come. So fluid will come. So those fluid along with the like a test tube, and you have a fluid along with the follicular fluid. So they bring it to the embryology lab, and you can see there is a stereo zoom microscope. Here they will carefully observe the follicular fluid and look for the oocytes or the eggs. So sometimes in the follicular fluid, only follicular fluid will be there. There will be no eggs, like only granulosa cells, or maybe like you have a small eggs like a germinal vesicle GV. Like that, they can scan through the microscope, and whatever you handle, all this area it will maintain 37 degrees, and it has to maintain exactly 37 degrees. If you are not maintaining properly, the oocyte like a spindle can damage, and it can give you the fragmented embryo or retarded embryo. So you have to be very careful when you are handling the oocyte. It has to maintain 37 degrees exactly. So wherever you manipulate during the egg collection, during the screening, during the ICSI procedure, everywhere exactly this 37 degrees will be maintained. So the embryologist carefully they are screening the oocyte, and they are picking the oocyte in the small glass pipette, sterile pipette. Then this oocyte will be transferred to the flushing media, is covered by under oil. So it has to maintain the pH temperature as well, and slowly they will flush it like whatever attached to the egg, like a blood, or maybe granulosa cells, or maybe any other thing. So slowly nicely they flush it, and then these oocytes will be transferred to the flushing media. So slowly you can continue this one until the egg collection is finished. After this, these eggs will be transferred to the immediately quickly in the IVF medium for further maturation. So whenever you are collecting the follicles, you have a big follicle like a like a 20 millimeter or 16 to 20 millimeter, mostly you will get a matured eggs. Less than like a 12 millimeter, or like a less than 13-14 millimeter or 12 millimeter, sometimes you can get a germinal vesicle, or sometimes you can get a like a metaphase 1 oocyte also. So this procedure is finished, patient is fine now. So they quickly transferring to the recovery room. So don't think that it's a long like it's a very small procedure. Egg collection will shortly they will finish.